Now we'll use massage techniques in a standing position that can also be used in a seated position. Now the first massage tool we use is a lacrosse ball, tennis ball, softball. Very similar to what we did on the wall, but instead of leaning against the wall, you can have your hand doing the same type of motions. So you could do the deltoid, the front part, the middle, belly, and even getting into doing serratus anterior, rolling and moving up and down, reposition, in that manner. And then we could do is you could cut a hole in a tennis ball, place it on the head of the hammer, and use this as a self-massage tool where there's a tool called a Theracane that is very useful. It could get in all places in the back, but if you don't have that, this might be another best choice along with a hockey stick. So first we're going to use the hammer, place it onto the rotator cuff. So right now I'm below the ridge and I'm moving up and down and side to side, just getting in to those areas. Now, in the anatomy video that I showed, we talked about on the back part of the deltoid where triceps comes in, that junction could get very sticky. So you could use this instrument right into that area and then just pull upward and then move side to side. So basically you're peeling the deltoid muscle away slightly just to break down the stickiness in that area. What we can also do is hold that position, rotate your arm backward, and as the arm moves backward, you're pulling forward to peel away the deltoid. Now, for the lats, you could take the hammer, grab it with the other hand, and you're hooking the ball right into the lats. And then as you move forward with your arm, you're pulling back on the hammer to address the lats. You can also address teres major and even teres minor. And in this position, with the ball, you can work on serratus anterior. What we're going to talk now is trying to address the subscapularis muscle because it's hooked in right in there. So the way to find it is you're going to bring your arm up, which swings the shoulder blade out a bit. You can place your hands just below your armpit, making contact with your ribs, and slide your fingers along the ribs until you feel muscle. Just to make sure that you're locating it, you could bring your arm down and it should contract where your fingers are. So lats are right here. So you know that the lats is that far out. Here are the ribs. So right in there is subscapularis. So that's where we're going to get at. So a few things you could get at with it. The end point of a wooden spoon. So making contact with the ribs. Slide it along. And then move up and down. And you can rotate your arm and bring your arm up and down. Now, another tool you could use is the wedge shape of the wooden spoon. We've done it with the end point of the wooden spoon, and you can see the thickness there. whereas now we're going to go into a tapered edge. So same landmarking procedures. Here are the ribs in the armpit area. I'm going to slide backward until you feel soft tissue or muscle tissue. And that is where subscapularis is. Rotate your arm inward to verify, knowing that it's contracting, which it is. And then I just push in with the wooden spatula, hold it there, and I could rotate and move the arm up and down, reposition the spatula, and do the same maneuvers. And then with serratus anterior, because as the fiber directions are coming this way, you could go with the fiber direction or against the fiber direction in segments. Now you don't have to have your arm hanging up there, but this is for demonstration purposes. You can have your arm on the wall in order to do this. Another tool you could use is your hockey stick, so the blade portion. So you're going to have it against the wall. Take the blade in the same landmarking position. So it's hitting the ribs. Slide along the ribs until you feel muscle tissue. Confirm by rotation, which I have. And what I'm going to do is I'm going to leave the stick there, apply a little bit of pressure, move the arm up and down, as well as rotate. And then reposition the stick. So that's for subscapularis. Also, for the deltoid, we've talked about using the hammer on the back side. With the front side, you can still use a hammer or a ball. So I place the ball on the front portion of the deltoid, and this is where biceps is coming up, the chest muscles are coming in, so it's in this area right here that I can get very sticky. So having the ball here, I'll just use a little crossbow in that area. As I rotate inward, I push the ball against the front part of the deltoid backwards. So as I rotate forward, I push backwards. So I'm, again, kind of peeling the deltoid away from the chest muscle as well as the arm muscle. With supraspinatus, right here, where it goes just underneath the collarbone, it gets very sticky in around that area. So here's the collarbone, goes around the shoulder, and then here's the ridge of the shoulder. So right in that area that I showed on the skeleton, this area gets very sticky. So you can use the ball right there, and then move the ball around the inner part of the bony structures where the muscle attaches to, the deltoid muscle. And you're also getting upper traps with this. And then you press in to get supraspinatus. And these are the techniques in a standing or seated position.